5-year-old lady comes with a history of severe headache on the left side. Take a history and counsel her regarding the management. Firstly, after introducing yourself to the patient and addressing her immediate concerns of a headache and offering her a painkiller, we go on to asking her about the type of headache. We ask her to describe the headache. What type of headache are you having? Sometimes she might say it's a throbbing headache. Sometimes she might just say it's a pressure. Describe the intensity of the headache on a scale of 1 to 10, 1 being the least and 10 being the maximum. Any radiation of the headache. What are the aggravating factors for the headache? What are the relieving factors for the headache? We specifically need to ask for cough aggravating the headache, and does vomiting relieve the headache? What about the duration of the headache? Any variation of the headache? Has there been a time when there is no headache and then suddenly there is a headache as well? Is it more in the morning? Is it associated with diplopia? In which case we would consider a space-occupying lesion. Is it associated with vomiting, which could be because of a migraine, because of a glaucoma, because of a space-occupying lesion? Have there been similar episodes in the past, which would mean that it's probably a benign condition like a migraine? Then we ask for a history of fever. Fever would indicate that it's probably a meningitis or a sinusitis or even a brain abscess. Is there any earache, ear discharge, or deafness? CSOM can be a cause for a brain abscess. Nasal stuffiness, which could indicate a sinusitis causing the headache. Pain in the cheeks and fullness in the cheeks can be because of sinusitis. Tooth pain or a history of caries might indicate a tooth abscess, which could cause a headache. Pain on opening the jaw. This is seen in temporomandibular joint arthritis. Pain on combing the hair. This could be seen in migraine or in temporal arteritis. A history of blindness. If it's an acute onset, new onset blindness associated with a headache, the first diagnosis is a temporal arteritis. Blindness can also be in a glaucoma, in which case the patient would have a red eye. The patient says she has no prior history of headache, her vision is good, and all other history asked was negative. We next counsel the patient. I think you have a condition called temporal arteritis and inflammation in the arteries in the temples. The tests that need to be done are an ESR, a CRP, and we also need to do a biopsy of an artery in the temples called the temporal artery. It might take about 4 or 5 days for the report to come, and therefore we need to start treatment urgently because I am suspecting this is a case of temporal arteritis. We will start steroids urgently in order to prevent blindness, which can be a complication. Prednisolone at a dose of 60 milligrams per day will be given to you, and we will taper it out to the minimum dose, which you may need to continue for a period of 2 years if it is proven to be temporal arteritis. Next, I want to describe the complications of steroids, which we need to monitor. Diabetes, hypertension, cataract, obesity, stomach ulcers, the patient may be prone to infections, and the patient may have osteoporosis. Then we ask the patient to clarify if they have any doubts and if they have any queries. Then we thank the patient and the examiner.